Hey guys, Cassandra here. I chose bipolar disorder as the topic of my PowerPoint presentation. And the reason that I chose bipolar disorder is because someone very close to me suffers from this mental illness. So I just wanted to use this opportunity to get a better understanding. What is bipolar disorder? So bipolar disorder is a mental illness consisting of severe high and low mood swings. This mental health illness also results in changes to sleep, energy, behavior, and thought process. So for an example, a person with bipolar disorder will experience periods of time feeling extremely happy and energized, which this is the manic phase, followed by times of feeling extremely sad and sluggish, so the depression stage. And in between these mood changes, the person feels completely normal. When a person with bipolar disorder is manic, they often become very irritable, impulsive, with reckless decision making. There are three different types of bipolar disorder. Bipolar 1 disorder is manic periods that last at least a week at a time. Manic periods are so severe that medical attention is necessary. Bipolar 2 disorder is erratic highs and lows, but less extreme than bipolar 1. And cyclothymic disorder is periods of depressive behavior and mania lasting at least a year in children and teens or 2 years in adults. The depressive behavior and mania are less severe than both bipolar and bipolar 2. Risk factors for bipolar disorder. So having a family history of bipolar disorder is a risk factor. The genetic part of bipolar disorder is still being studied. Bipolar disorder is equally common among men and women. Drug abuse, alcohol abuse, those also put you at risk for bipolar disorder. And certain health conditions, including anxiety, PTSD, depression, or OCD, go hand in hand. Treatment options, so medications or therapy, usually a combination of both. A person with bipolar disorder may need to use a combination of different drugs, including mood stabilizers, antipsychotics, antidepressants, or sedatives. Different types of therapy that are available: psychotherapy, cognitive behavioral therapy, psychoeducation, and family-focused therapy. Tips to manage bipolar disorder. So on top of medications and therapy, there are other suggestions. Physical exercise, that's good for everybody. Avoiding substances such as caffeine, nicotine, and alcohol. Other people with bipolar disorder are great resources for support. Keep a mood journal. It may help you identify your triggers and know when to seek help and when to ask for help, and how to ask for help. Prevalence. So bipolar disorder affects about 2.6% of the adult U.S. population each year. And this study was just from adults ages 18 and up. The median age of onset bipolar disorder is 25 years old. The prevalence of bipolar disorder is increasing progressively over time. So what does this mean for the future of bipolar disorder? Currently, bipolar disorder is diagnosed and treated based on clinical symptoms. But with the increase of scientists studying the role of genetics in people with bipolar disorder, future diagnosing and treatment may improve drastically. The drug lithium, the most commonly drug used for bipolar disorder, was discovered in 1949. Not to mention that a person with bipolar disorder takes on average 3 to 4 different combination drugs for effective treatment. As of 2019, a new study that combined a dose of rapid transcranial magnetic stimulation and a high dose of thyroxine was very effective at treating bipolar disorder symptoms with little to no side effects. This cuts back on the amount of drugs a person with bipolar disorder would need to take each day. So in the future, it looks like we have some things to be looking forward to. Just a little more information on bipolar disorder, some symptoms. The left is manic phase, while the right is the depressive phase. So these are some ways that people diagnosed with bipolar disorder describe it. Trying to catch up to your own mind, frightening to be so out of control and so off balance. Normal people are annoying because you'll never have that stability. Productive, carefree, and then exhausting. Things are going great and it's scary because you know it will not stay that way. Difficult to tell if you can trust your own perception of reality, and you feel everything at once and then you're numb to the world. And these are my references. Thanks.